Hello, I'm Ned Kalanj. I'd like to welcome you to this meeting of the National Academies Committee on Guidance on PFAS Testing and Health Outcomes. As this is an open session, I will start by reading our disclaimer for public sessions. As chair of the Committee on Guidance on PFAS Testing and Health Outcomes, I want to welcome everyone to this first day of the committee's sixth meeting. I want to notice that this is an open, on-the-record information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions, and it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the academies. For those of you not familiar with the committee process, this is the sixth of several planned public committee meetings. In the public session, we have the opportunity to hear from many experts in the field and to receive public testimony. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee. And the committee must then respond to the review with appropriate revisions that satisfy the Academy's Report Review Committee and the chair of the National Research Council before it is considered an NRC report. The expected report release is spring of 2022. Further information on the study, including future meetings, can be found on the project's website at the National Academy's website. The committee is being asked to provide advice for clinicians about PFAS testing and how test results should inform clinical care. Additionally, our expert committee will examine the health outcomes associated with PFAS exposure and will develop principles clinicians can use to advise patients on exposure reduction. In this meeting, the committee will hear from experts on the contribution of PFAS exposure sources to human exposure, clinical principles for advising patients on exposure reduction, putative health effects of PFAS, and methods for evidence synthesis. During panel discussions, the moderator and committee will ask questions of the speakers. If you are viewing on the web, you may send any comments to Liz Boyle at EBOYLE, that's eBoyle, at nas.edu. The meeting is being recorded. Available speaker presentations will be posted to the project website soon after the meeting. Now I would like to ask the committee to briefly introduce themselves with their name and affiliation only. And I will start. My name is Ned Kalanj. I'm the president and CEO of the Colorado Trust and a member of faculty at the Colorado School of Public Health and the Colorado School of Medicine. And Laura, would you please go next?
Yeah, hi, Laura Anderko, co-director of the Mid-Atlantic Center for Children's Health and the Environment at Villanova University College of Nursing. Welcome, everyone.
Erin Bell.
Hi, I'm Erin Bell. I'm a professor in the Departments of Environmental Health Sciences and Epidemiology at the University of Albany School of Public Health.
Kevin.
Hi, I'm Kevin Elliott. I'm a professor at Michigan State University and a member of MSU's Center for PFAS Research.
Thanks, Kevin. Melissa? And you're on mute, Melissa.
I'm trying to use both my phone.
We can hear you.
Hi. All right. I think we're okay now. Hi, I'm Melissa Gonzalez with the University of New Mexico. I'm a faculty member in the Department of Internal Medicine in the Division of Epidemiology, Biostatistics, and Preventive Medicine.
Thanks, Melissa. Erin Haynes.
Hello, I'm Erin Haynes. I'm professor and chair of epidemiology and preventive medicine and environmental health at the University of Kentucky.
And Jane.
Hi, I'm Jane Hoppin. I'm a professor at North Carolina State University and deputy director of our Center for Human Health and the Environment.
Thank you. Tamara?
Hi, everyone. My name is Tamara James Todd. I'm an associate professor of environmental reproductive epidemiology at Harvard Chan School of Public Health.
Alex.
Hello, everyone. I'm Alex Kemper. I'm Chief of Primary Care Pediatrics at Nationwide Children's Hospital.
Brian.
Hello, I'm Brian Lind. I'm an occupational environmental medicine physician at the Yale School of Medicine in Connecticut.
Mark.
Hi, I'm Mark Werner. I'm an associate professor at the Department of Occupational and Environmental Health at the University of Montreal.
Veronica.
Hi, everyone. I'm Veronica Vieira. I'm professor and chair of the Environmental and Occupational Health Department at University of California, Irvine.
Thanks. Shiabin.
Hi, I'm Xiaobing Wang. I'm a professor at the Johns Hopkins Bloomberg School of Public Health, and also I'm a professor and attending pediatrician at the Johns Hopkins School of Medicine. I direct the Center on Early Life Origin of Disease.
Thanks, Shaman. And Chris Wyatt.
Hi, I'm Chris Wyatt. I'm the recently retired founding president and CEO of the Caring for Colorado Foundation, a health funder.
I would also like to have the National Academy staff introduce themselves, starting with Elizabeth.
Hi, I'm Elizabeth Boyle. I'm a senior program officer here at the National Academies, and I'm the director of this study.
Rose.
Good afternoon, Rose Martinez. I direct the Board on Population Health and Public Health Practice here at the Academies.
Cliff.
Hi, I'm Cliff Duke. I'm director of the Academies Board on Environmental Studies and Toxicology.
Thanks, Cliff. Marilee. And you're muted, Marilee, so maybe you're attending to something else. So I'm going to ask Kate. Oh, no, there's Marilee. Hi.
Hi, this is Marilee Shelton Davenport with the Board on Environmental Studies and Toxicology.
Thanks. Now, Kate. Now, Kaylee.
Hi, everyone. I'm Kaylee Bynes. I'm an associate program officer with the Board on Environmental Studies and Toxicology.
And Alex.
Hi, I'm Alexandra McKay, and I'm a senior program assistant on the board with Population Health and Public Health Practice.
Let me just pause and ask if I missed any staff or board committee members. Great. So the goals of the next 2 days are to hear from experts on PFAS clinical guidance. We hope to learn about ethical principles that could inform frameworks for decisions about clinical evaluation and biomonitoring, and how these have been applied in PFAS contaminated communities. We'll hear considerations for treating patients in PFAS contaminated communities. Then the final session will identify strategies for communicating biomonitoring results and the opportunities and challenges with connecting biomonitoring to clinical care. The structure of the meeting is we have a group of invited talks by speakers, individual speakers, followed by panel discussions that will be grouped by topic area. Committee members will ask questions via the raised hand function during the panel discussion, and we will close with public comments. And people have signed up ahead of time in order to provide those public comments. And so without any further ado, I'd like to go ahead and get started and introduce our first moderator, Kevin Elliott. Dr. Elliott is a professor at Michigan State University with joint appointments in Lyman Briggs College, the Department of Fisheries and Wildlife, and the Department of Philosophy. His research lies at the intersection of the philosophy of science, research ethics, and environmental ethics. Dr. Elliott received his PhD and his MA in History and Philosophy of Science from the University of Notre Dame. Kevin?